no matter what your profession, no matter what your skill level, whether you're an amateur just trying to help out or you're a seasoned practitioner, if you are pressing on someone's back and you hit a sore spot and they ask, "Is that a knot?" It is your obligation to say, "Well, it's not a knot." And after they stop laughing, they wipe away the tears from their eyes and usually finish tipping you double your normal pay. You can explain to them, well, it's a little more complex than that. That's generally what you want to do. And it'll make you sound intelligent for one, but it'll mean you know what you're doing. That's kind of an important thing. So a knot in the back it's not the greatest term, to be honest. There's a lot of things it could be. I'm going to start with one thing you probably shouldn't mess around with too much, that being vertebral rotation. Understand there is a lot of muscles in the back. There's some particularly long ones, like so. They go fairly far up. There's some intermediate sized ones, and they go also a very long distance. And then we can get smaller and smaller as we get into even the smallest muscles, what we call deep intrinsics a lot of the time. And they go very short distances in interesting patterns, in fact. And these go all up and down the spine. I'm not doing it justice with this image here. The complexity is quite immense. But that being said, they are local to the spine. As we get tighter and tighter, we get smaller and smaller when it comes to the spine. But it doesn't mean absolutely that what you're pressing on is in fact muscle. Even with all this extra muscle, we could be pushing on something else. What you have to understand, these little guys here, these vertebrae, have tiny arms on the side. They've got an arm here and an arm here. They've also got a spinous process. They've got lots of parts, but they've got these sticky outy parts. And from the top down, so this is looking at from above, this transverse process, this little arm here, is like that. It's like so. So it's pointing out. And the muscles will be covering this. Do understand that the muscles will be running kind of this direction. They'll be kind of running up and down all the way around this thing. But it doesn't mean you can't contact that. Those TVPs, transverse processes, the processes on the side of the vertebrae, are actually palpable. You can press on them. And the truth is, when they rotate backwards on you, when they start to spin like so, come back like this, you actually get that transverse process pushing back. So it means it's a bit more palpable because the skin and the muscle over top is kind of spread out. So it's pushing back, it's rotating back. And so that means the covering of it is stretched. It's easier to pass your finger through. And this means we're not really pressing on muscle. Muscle can be released, but generally you don't want to release bone. Generally you don't want to push too hard on that. In fact, what you end up doing is mashing the tissue. You're squashing the tissue against bone. And one of the three, your finger, the TVP, or the skin muscle will give, and I can guarantee you it's going to be that skin and muscle that takes on all the pressure. Ultimately, this is painful, of course, and unfortunately it can do this kind of thing where it hurts so good. It actually feels kind of good when you're doing that because you believe something is happening. You, the patient, you, the practitioner, no matter what skill level, you think something good could be happening. But ultimately, when it ends up happening, there's a bit of irritation when this is the case. So you are pressing actually on bone. You're mashing some of this musculature here. And this is actually something that is detrimental. It's kind of like just hitting the muscle, straining it, in fact. You're not really doing anything beneficial. It's irritating, and it often causes more of a reflex back into the tissue. So the nerves that happen to pick it up will reflex back into that spinal cord and say, hey, something's really wrong. Ultimately, you may end up causing more damage than you do help. In this case, you may actually make the muscles tenser after the fact. They can give up. They can kind of stop doing what they're doing temporarily in that area. But all you've done is press on bone. And so in this case, you may want to consider, if you're feeling something really, really hard, something solid like a bone, you may want to leave that, because taking care of these rotations in the vertebra, taking care of all these side bends and rotations, the spin of the spine, the back and forth of it all, and the rotations posteriorly towards the back, this might be a professionals only thing. This is our chiropractors, our physiotherapists, osteopaths, fascial stretch therapists, someone who's really well trained. That might be the right person for that particular job. Now, that being said, there's other options too, and these are the things that you can deal with, that many people deal with at different skill levels, from early to later in your career. We can kind of break it down. Now, it can get more complex. Kind of break it down into two, I'll say, major categories, that being a contracting muscle actively and a fibrosis, something that is now technically inactive. We associate this with contracture, though we're not using that word really because we don't want to confuse it with the medical term, but we can also associate it with a muscle that is not active. It is thickened and it has stopped moving. So it could be any one of these. So I'm just going to draw one in here, one or two. Let's say we've got a muscle that goes from about here to here, these 2 points, 1 and 2, and then we'll throw in another one that also goes from here to here, and we'll just differentiate between the two. So one of them, the contracting, we'll say that's the red one, just to identify. The contracting muscle is active. It has active nerve tone going to it. So there's nerves that are coming off that spine that are going to it, that are electrifying it. Not really. It's not really electrifying. This is an electrical potential, but they are electrifying it, quote unquote. And so it is actively contracting. And when something is actively contracting, it means it's metabolizing. It's actually generating some heat. What a lot of people don't understand is that when you contract a muscle, there's a secondary benefit other than the movement. There is actually a secondary benefit of heat generation. So having a warm, active muscular system is just a byproduct of movement, but a useful one, because we need that for cold weather survival and that kind of thing. If we compare that, the fibrosed tissue, it is not actively moving, so it tends to be on a colder level. So it is palpably cold to the touch. There's icicles coming from it. Brr. There we go. That's a horrible icicle. Get rid of that. There we go. Anyways, so this is an important difference. These are things you can feel. These are things you can look for. And I'm being general here. Of course, we could get more complex or less complex. But you'll notice too, it's solid and unyielding. So it's got more of a rigid, some say rubbery feel. It's not the greatest term, but a solid and unyielding feel. So as you push into it, as you, the practitioner, of course, your hands are always blue. As you push your finger into it, you'll feel it doesn't give in the same way. Whereas if you were to press into that muscular tissue, you put force into it, it will still have a bit of give. The main difference is that the solid unyielding element has built up some extracellular matrix. This is the thickening we're talking about when we say fibrosis. So it's built up, this purple muscle here that's been doing this for way too long has actually thickened the tissue around it. It's a reinforcement process, and it's usually to ensure it doesn't go much further out of place than it already is. It protects it from tearing, but at the same time totally limits the motion. Both of these will be limited in motion. Active tone, keeping that muscle contracting, will stop you from moving, but it is active because it's generated by nerve. Fibrosis, the buildup of ECM, will not move, but for a different reason, because there's too much tissue there. There's too much holding it together. It's actually become too strong for its own good. Based on that, we actually do different things to the tissue to get it moving, to get it healthy again, as you should, because you should also be reading the tissue actively. You should be aware of what's going on to your hands, and you should be using that understanding to tell you what to do. So it tends to be, because of the fact that this is nerve tone here, that we've got active nerve tone, we use a holding inhibition in this area, not exclusively, but as a general rule. So instead of vigorously stimulating, instead of just going all over it like that, just scribbling all over it, we tend to hold a constant pressure, maybe even with a small, slight circular motion. If we move it too much by comparison, we'll actually increase the nerve tone local to the area. We'll raise it up and up and up. And just kind of like when we were pressing on bone, which is ultimately a bad idea, we overstimulate the tissue and we further add to the nerve tone, further adding nervous reflex, creating more of a problem. So we don't want to do that. So if we use gentle holding, we sustain pressure, we can actually get the nerve to calm down because we've stabilized it. It has no more reason to be actively contracting, or at least we can reduce the reason. Comparatively, in fibrosis, because we've built up thickened tissue, we may want to use more rigorous stimulating methods. We have to be careful with that as to not overstimulate it, just like anywhere else in the body. But you may want to use a slow circular motion getting towards a bigger motion, or a sustained stretch, what we call myofascial release. We actually need to encourage some fluid motion in this case because we've built up ECM. Again, remember, we've built up tissue, so we've got to get some better blood flow into the region, so we might use a little bit more aggressive, always erring on the side of caution. Ultimately, what that results in is both these things will give us better energy and movement. If we release a muscle that's contracting or thickened, fibrosed, we get better movement in the vertebra, in the general region. Remember, we could be doing this, we were talking about local muscles, but we could be doing this to a muscle that goes all the way from here to all the way up there. It's the lats for those interested. And if we get that moving, we actually get the whole body moving better because it's a big, wide girdle to girdle muscle, shoulder girdle to pelvic girdle. We could be doing it to a small muscle, to a big muscle, but ultimately better motion. But at the same time, we free up energy in the body. And this is often understated when we look at the manual therapy world, because if we have a contracting muscle, for instance, we're wasting energy contracting that muscle. It's extra effort to do that. In fibrosis, we're essentially slowing down motion, and we need more effort to do the same motions in the body. So if I have short muscles, I've got muscles holding me short on this side here, so I'm bent towards the right more so, it's going to be a lot harder. It's going to take a lot more effort to bend me to the left. It's a simple example, but that's essentially how it works. So if I get rid of that motion loss through thickened tissue, through ECM, ultimately end up with better motion, and I conserve more energy. I don't waste energy. The last thing to mention too is always be cautious. Always be careful with your pressure and application. In every example, you could say too much is too much. It's a really, really simple thing. Don't press too hard. And you might need more time. It's better to do something at low pressure over a longer period of time, and that might be a series of treatments over the course of a single treatment. To get the same effect, the body will adapt and take that on much better. There's only so much this incredibly complex mechanism can take, so we need to be aware and conscious of that. And we also need to get rid of our ego, most importantly. Faster is not better. Harder is not better. So if we take away our want to get an instant result, oftentimes we find we have much better success, which should make you happy. As always, this has been Elge from Simple Lines Anatomy. I had a great time doing that. Hope you enjoyed it too.